everyone. Welcome to another session of Doc Talk. Today I'm joined by a foot and ankle surgeon, Dr. Rimawi from New York. Welcome.
Thank you. Thank you for having me. I appreciate it.
Before we get started, can you share an interesting story with our audience?
Sure. In relation to the field of podiatry?
Yes.
Oh my God, there's so many, So I trained at a trauma-based program. So we saw all the high-end vehicle accidents and traumatic injuries that were within like a 5-mile radius. And unfortunately for us, or fortunately for our training, the intersection we worked at was like the third highest volume for accidents in the country. So in terms of interesting stories, I could go on and on and on and about them. But the interesting stories are by far the most gratifying stories, right? So for instance, without giving too much detail, there was once a patient who was unfortunately hit by a motorcycle and suffered polytraumatic injuries to the shoulders, knees, hips, and the foot and ankle was completely dislocated. We're talking about exposure of one of the ankle bones known as the talus. We're talking about comminuted fractures, which means her ankle bones were shattered into pieces. And why that story sticks with me, because that was the first case I was involved in that involved multiple specialties at once. So we were in the surgical suite and everybody was just kind of communicating with each other. We had the plastics team there, we had the traumatic surgeons there, and then we had the orthopedic surgeons. And you basically had teams working in combination with each other. So while one person was at the front of the table taking care of her broken clavicle, we were at the bottom of the table taking care of her foot and ankle. And to be honest, that was one of the first cases where I said, I can't see a scenario where this patient has a good quality of life. And for the longest time, it seemed that way. The patient was in a coma. We fixed all the bones that we possibly could. We maintained the blood and the whole 9 yards. And then 6 months later, she came for follow-up in one of our clinics. And it was as if, I don't want to say nothing happened, but God bless, she's doing just fine. So I think that was the most probably interesting and memorable story for me from my training.
That's amazing. All right,
Yeah.
Doc, can you give us an introduction about who you are, what do you do, and where are you practicing podiatry?
Sure. My name is Mohammed Rimawi. I'm from New York, New York. I have a private practice in Grand Central. I got my education at the New York College of Podiatric Medicine. I then went on to do my first year residency in Georgia at the Podiatry Institute, and completed my next 2 years at the residency I just spoke briefly about in Philadelphia, Aria Jefferson.
Beautiful. So why podiatry?
It kind of just fell into my lap. For the longest time, I thought I was going to do orthopedics. I wanted to be an orthopedic surgeon, work with athletes, most notably in the foot and ankle. It was just a pure coincidence that I discovered podiatry in my college career. When I did my homework about the road to podiatry and the road to orthopedics, the decision was much more clear for me. So in the orthopedic realm, and I'm sure this goes for any specialty, you would have to not only get into med school, which is a difficult task in itself, but after taking your step exams or your exams to proceed into residency, you have to match it to a specific residency. And to be honest with you, at the time, I was a little nervous about that because I told myself, if I don't get into an orthopedic residency, I think I'll be miserable, right? If I match into something I'm not completely happy with, I don't think I can do that. I could suck it up for the rest of my life. And then after matching into orthopedics, it's, I believe, a 5-year residency. And if I wanted to specialize in the foot and ankle, that would be 1 extra year. Mm-hmm. So for me, I kind of just sat down and said, well, that's a really long road and a lot of debt that I'm accruing. And at the time, I couldn't make that sacrifice. I'm the oldest of 6 children. I have parents that work very hard. So for me, when I discovered podiatry and discovered it was a 4-year med school route, I'm already specialized in the foot and ankle, and then it's 3 years residency with the debt being modest compared to my peers. It was a no-brainer for me at the time.
Beautiful. So what do you think were some of the challenges that you faced, coming from an immigrant family and, like you mentioned, you were one of the oldest children, so you had a lot more responsibilities on your shoulder. What do you think was the biggest challenge for you going into podiatry school and getting through residency, which is not an easy feat, and then, starting your own practice?
Yeah, there's a few different challenges, but I think the biggest one is you kind of learn everything on your own, right? So you don't have someone you can ask for advice. I still remember, coming from an immigrant family, anybody could relate to this. The father is kind of the tough love kind of guy. So I still remember till this day when I would tell my father, hey, residency, it's really tough, man. I'm struggling here. He would reply by saying, oh man, I thought the kids in Africa had it bad, but you have it far worse, but that's kind of the responses you get. But the road, like the things you have to do, I still remember till this day. I didn't even know that SATs and getting into college was important. I just woke up one day and took my SATs. And for the MCATs, I didn't even know what to do, what books to get, where to go. So you kind of learn these things on your own. Luckily for my sisters, I made those mistakes and figured out those trials. So things were much easier for them. But that's, I think, the biggest hurdle when you're a first generation American here.
Absolutely. And I think, I mean, I went through the same thing. My brothers went through the same thing. And it's just, you have to kind of make the mistakes in order to figure it out. Like, I never took the SATs. I didn't know they were important. And then taking the MCAT, I thought I could just learn everything myself. But it's the little stuff that makes a big difference. And, and I think this kind of platform where we get professionals together and talk about these challenges is what creates dialogue and helps those who are thinking of pursuing careers in medicine, in podiatry. And I think that's what we need is, just get the dialogue started so that people have some sort of a resource to look up to. And I think YouTube is one thing that, everybody has access to and is constantly on. So it's nice to be able to provide that for them.
Yeah, I think you hit it on the head with that one. Just because you're doing well in school, which I'm sure all of us are, doesn't mean you're going to do great on a standardized exam. The exam has its own hurdles. You can memorize all the information, but if you don't know how to attack the questions or the type of questions they're giving you, you may not do so well. So studying for an exam and studying for a standardized exam requires two different completely mentalities. And that's why they offer courses for MCATs or SATs, because they understand that. But when you're coming out and you really don't have much guidance, you really don't know that. Like I said, I literally woke up one day and took those exams. I made nothing of them. I bought a couple of MCAT books, studied for about a couple of months and took them. Had I known what I know now, I would have put definitely more time and effort into it. But everything happens for a reason, so no worries.
Absolutely. Absolutely. So we talked about podiatry. Now, are there other things you can do in podiatry? I know you said there's a 3-year residency. Are there fellowships that people can pursue? And you mentioned that it took you, so you do 4 years of pre-med, you do 4 years of podiatry or medical school, and then from there you do 3 years or more of residency?
Yeah, so there's a different residencies in the country. Some are 3 years, some are 4 years. Most of them are 3 years. Now, all of them have surgical training. You actually have to graduate with a certain number of surgical cases to become a certified podiatrist or a practicing podiatrist. There are fellowships throughout the country, and these fellowships specialize in different things. So if you want to touch up on trauma or reconstructive foot and ankle surgery or pediatric surgery or diabetic foot care, there's so many different things to choose from. Podiatry is not just clear and cut one thing. There's different avenues within podiatry. And sometimes if you want to make that your niche, a fellowship would be the way to go. Others do a fellowship just to brushing up on their skill set. You may not feel that your residency was completely adequate in training you for the things that the real world prepares. So you want to do a fellowship to get some extra experience. And that's all fine. You'll make that decision at the end of your residency. It'll be clear on which realm you want to pursue.
Absolutely. So let's talk about student loans. I feel like all of us that are in graduate school and after graduate school are left with this large lump sum of student loans, and we really don't know what to do with it. Let's talk about how expensive it is to, on average at least, to go into podiatry school, and then how do you go about handling that type of large amount of money?
Yeah, so that was one of the biggest reasons I went to podiatry school. The school I went to was the New York College of Podiatric Medicine. It was an hour and change train ride from home. So I told myself I want to make sure I have the least debt as possible, and that included living at home. And that's what I did. I lived at home. The tuition for that school was, I believe, starts at $26,000 and ends at $30,000 per year. So it comes out to being about, let's say, rounded out to $120,000. Now, there are scholarships available before you get in. They offer you scholarships. And during your training there, if you're doing well in academia and whatnot, they'll give you more money. So I was able to amass around, I think, I want to say over $30,000 in scholarships. So I graduated with a clean 100,000 in debt. And that was big for me. That was huge for me. There are nine podiatry schools in the nation, but I only applied to a couple because I told myself I want to minimize my debt. And if the education for the most part is within par with each other, I didn't see one was more superior than the other. So I did have that opportunity. Not everybody has that privilege. Some people are forced to move, and now they have to pay for expenses such as rent, food, day-to-day living expenses on top of tuition. So their loan debt may be higher than mine. I know some of my colleagues graduated with 200 to 300 grand worth of debt, and that's not like crazy. In terms of tackling student debt, I've read a lot about this topic on what to do. People went the public loan forgiveness route, but now they're regretting that because they're not getting the rewards they thought they would. People are paying the minimum and trying to pay for 25 years in hopes that that's forgiven. Some people are putting all they have into loans. Everybody has a different strategy, but one thing I constantly read that is the best strategy is just to pay off as much as you can as fast as you can. The interest rates for us are 6.8 to 7%, which is very, very high. So that was the strategy I did. I said, I'm just going to live under my means for the first couple of years and give everything I can to the student debt. Because once that's off my shoulders, then I could start to look into other things. My strategy may not be good for you or somebody else, but that was my thinking at the time. And so far it's done okay.
Beautiful. So let's talk about private practice. How was that like? Nowadays, I've heard that it's harder and harder to be able to start your own practice. So how did you go about that?
Private practice is very tough. I was very naive when I graduated because I thought I had this surgical training and I had these academic achievements and that would translate into instant success. However, that's not the case. Private practice is very much a business in every sense of the word. Everything that a business needs to thrive, a private practice needs the same. Marketing costs, logo designs, advertisement, overhead, rent, employee salaries, benefits, all these things come into play. And then only then does your surgical training or your knowledge come into factor. The only thing that's free that you have in your hands that'll help your private practice grow is the way you treat your patients, really. The word of mouth will always be a great marketing tool. However, in a saturated field such as podiatry in New York City, it becomes a little frustrating at times. So I would definitely delve into, or if you're thinking about doing private practice, to doing your homework very extensively. It's private practice isn't a walk in the park at all.
Absolutely. So we talked a little bit about podiatry and orthopedic surgery. So with podiatrists, they mostly focus on the foot and ankle, or can they go above, or is it just below the knee? Can you give us?
Yes. So there are different rules in different states. Some states you can work on from the hip below. Now, when I say the hip below, I mean soft tissue from the hip to the ankle, meaning skin grafts and things of that nature, and then bony work at the ankle and foot level. And grafts, I'm sorry, you can't take bone grafts from the tibia, which is a little under the knee joint. But some states only allow you to work in the foot, some allow you to work in the foot and ankle. So it's regulated state by state, but a generalized description is foot and ankle for the most part.
Gotcha. So what are some advice and tips that you have for students who want to pursue your footsteps, that want to be able to do podiatry and become foot and ankle surgeons?
Yeah, you have to really do your homework in it because if you don't want to do this whole process will overwhelm you. The studying, the med school process can be overwhelming in itself. Then the residency can really eat you alive. And then the roads or obstacles of private practice all add up on each other. And if this is something that you're not entirely sure you want, quitting becomes so much more easier for you. So my advice would be shadow multiple podiatrists. Some people shadow just one person and say, wow, he seems happy. I want to be just like him. Yeah, you want to shadow everybody and get a well-rounded perspective of what life for a day-to-day podiatrist is. It's not all surgery. It's not all ankle sprains and fractures. There are some day-to-day things you have to do. And you want to be sure that you're comfortable and prepared to do that.
Absolutely. So let's talk about some common cases or some common stuff that you see as a podiatrist? I know diabetic foot wounds are one of the main stuff that we consult podiatry at our hospital, but what are some common stuff that you see in New York?
Yeah, so I'm in private practice, so the things I see are a little different. In a hospital setting, sure, I'm sure wounds and trauma are the two main things they're getting consulted for. However, in private practice, you're seeing the average day civilian, right? And in New York City, the average day civilian here takes about 10,000 steps a day. So we're seeing a lot of foot and ankle issues just related to wear and tear. So the number one thing I see is a condition known as plantar fasciitis, and that's an inflammation of the ligament type structure on the bottom of your foot. It starts from the heel and extends to the tip of the toes. People will generally wake up, step on the ground, and say, "Oh my God, that hurts. Why can't I put my heel on the ground?" And for someone who has no idea what this is, this could be alarming because they think they broke something or tore something. I've had people have so much pain that they've actually admitted themselves to the emergency room saying, "I don't know what this is." And the unfortunate thing about plantar fasciitis, again, it's a soft tissue structure. So they'll take x-rays and say, well, there's really nothing here for you. But any podiatrist who graduated from school should be able to diagnose that problem. So that's probably the most common thing I see here. The second most common thing I see, again, because it's New York and there's a lot of runners and walkers, are something known as stress fractures. Stress fractures are just this diffuse pain in the front of the foot or in the middle of the foot, and you have no idea why you got them. You didn't kick anything, nothing fell on your foot. All you know is it's a little swollen, there may be some bruising, and it hurts to put your foot on the ground. Now, this is another thing where you may go to an urgent care center, they'll take x-rays and say, hey, I really don't see anything, so I'm not sure what you have. But the thing about stress fractures is they don't appear on x-rays for about 2 weeks till after you notice your symptoms. And a podiatrist or orthopedist should be able to make that diagnosis just based on your complaints alone. I would say those two conditions are by far the most common things that come through my door.
Very good. So let's talk about work-life balance, because being in medicine can be very consuming. What are your secrets of having a balanced life?
It's tough. In residency, I didn't really have that. I'll be quite honest with you. If I wasn't in the hospital, I was sleeping. That's just, it really becomes overwhelming and exhausting. When I finished residency, and some people don't take this approach, I made the effort to make sure that never happens again. So a lot of my colleagues do work on Saturdays or sometimes Sundays, half days. I told myself, yes, this probably would be a good marketing tool, would put my face out there, probably be better for me. But I think I sacrificed enough. You know, I put a lot of time into med school. I didn't really do the whole experience of going out and having a great time during my studies because I just focused on studies. The same thing with residency. I was a hospital rat. I always stayed in the hospital, reading in the surgery, observing other surgeries. So I sacrificed my life in that aspect as well. So when I graduated and I went into private practice, I told myself, listen, I'm just going to work 5 days a week. I'll work very hard during those 5 days. But Saturday and Sunday, that's just going to be my time, and I'm not changing that. And that's my balance. Now everybody's different, but for me, this is the formula that's worked so far.
Beautiful. So any last minute thoughts before we wrap up?
Yeah, I think you said this earlier. I'm not sure if we said it recorded or not recorded, but there's so many avenues nowadays to choose from. We have the internet, we have social media, we have YouTube. There's no reason not to equip yourself with the knowledge before pursuing something, whether you want to pursue medicine or any other avenue. There's so much at your disposal that we didn't have for so much per se, right? We talk back first generation. So if you are thinking about the podiatry route, if you are thinking about medicine, if you are thinking about some other field, I would really advise you take the time to think about this. Don't do it just because you were smart your whole life and you're told to do medicine. Don't do it because there's some external factors or pressures that are forcing you to do this. I mean, do it because you truly did the homework and you shadowed and you made the conscious decision that this is what's best for me. I think that in itself will go a long way for you.
Absolutely. Well, thank you so much, Dr. Rimawi. It was an absolute pleasure, and thank you for taking your day off to spend with us.
Oh, no, thank you for having me. The pleasure's all mine.